Welcome to Pharmative Live on Facebook Live. I'm Dr. James Partyka. I'm a clinical pharmacist and research scientist and the founder of Pharmative. And Pharmative Live is all about having some time with all of you to share ideas, information, to educate ourselves, all to improve the health care of you and your loved ones. So I'm happy to be here today. It's a beautiful day in Palm Springs, California. Those are the two theme songs. Oh, that's the third one. Let's just close this down here. Okay, we'll have to edit that out. Those are the two theme songs you heard before, so that when you hear them, whether it's during the week or on the weekend, you'll know that we're about to have another Pharmative Live, which is every Sunday. I always say eat, pray, and love Pharmative Live on Sundays at 10:55 a.m. Pacific time. We also have, very shortly after the show, we include a instant replay, a watch party as well, and we'll include subtitles as well, because I know there's a lot of jargon in medicine and it gets a little bit confusing. And so one of the things that I try to do, and I'm working with two cameras here for the first time, so I'm trying to kind of have eye contact with both audiences. One of the things that we try to do is to simplify the information into clear, concise messages so that you can understand more easily, and you can relay that information to your prescribers, to your clinicians and nurses and pharmacists, so that you make informed decisions with them as well. It's medicine is complicated, and there are a lot of different medicines that are available over the counter as well as by prescription, and it's difficult sometimes for everyone to keep track of, what is the medicine I'm currently on, what's the dose, how do I take it, and so forth. And then when there's a new change to the medicines you take, especially as we get older, that may change the efficacy and safety profile of the medication that you were taking before. So again, it's very important to keep a healthcare journal, something you're going to hear me say a lot about keeping a healthcare journal. Write down your drug allergies, write down your medications, the dosage, how frequently you take it, and the start date and stop date. And that information is really important, especially as you go from one doctor to another doctor's practice, or one hospital to another hospital, or you move. And then it's always a really good idea to sit down on an annual basis and reevaluate your medicines and how you're taking your medicines, and then to assess whether there are any drug interactions. And we're going to talk a little bit more about that later on, so hold that thought. Today we're going to be starting a 3-part series on over-the-counter pain relief medicines, oftentimes referred to as analgesics. And with that, it's complicated. And even though medications that are available over the counter, they, generally speaking, have a better safety profile than prescription medications. That's because of the development of the drug and the long-term use of the drug. We've determined the safety profile, we've characterized it, we understand it's been generalized to many different populations, and that doesn't mean that new safety signals don't pop up, but they're deemed safe enough to be available over the counter, and you can buy them in one of your pharmacies or convenience store or at a hotel, just because that it's been decided they're safe, they're effective, and patients need access to these medications. Okay, so with that, later on, we're going to be talking about only one drug, the drug that's been around the longest. For over 2,400 years, this drug has been available. And it was started to be used 400 BC by Hippocrates. And that's my little teaser to stay online to understand which drug that is, because it's a very interesting drug. And I guarantee you'll learn things that you never knew about this drug, even though it's so commonly used. But when we talk about pain relief medicines, analgesics, we can characterize them into really 4 buckets. The first that stands alone is acetaminophen. The brand name is Tylenol. and it's used in adults and children to reduce pain and fever. I'm sure you're familiar with Tylenol. And next week we'll be talking about Tylenol because there's some important information for you to know about those as well. That's another tease. So the next category is what they call NSAIDs. And when we do the replay of this later on today, you'll see subtitles that'll help you recognize easier and understand exactly what I'm specifically saying. NSAIDs is an acronym, and it refers to non-steroidal anti-inflammatory drugs. So those include drugs like aspirin, ibuprofen, and naproxen. Okay, so those are NSAIDs. And the reasons that they're called NSAIDs is to compare them and contrast them to steroidal medications. Orally, systemically, are not available over the counter because of their long-term side effects. And appropriate usage of those medications is very important. And so they're only obtained by a prescription, and they should be used on a short-term basis as well because of their long-term side effects. Now, the exception to that is hydrocortisone, which is available topically to relieve itching, and you'll see that in a number of products. But all of the other steroidal drugs related to a steroid chemical structure, that's why they're called steroids, are available by prescription only, generally in the United States. And the final category would be topical medicines like lidocaine and benzocaine, which basically numb up the nerves associated with localized pain. For example, a backache. There's several lidocaine patches that can provide local pain relief by numbing up the nerves in that specific area. There's also products available for oral medicines for a number of different reasons as well. The generic name on that is benzocaine. So anyways, 4 buckets: Tylenol, NSAIDs, steroids, topical canes, lidocaine, benzocaine. And those are 4 categories that if you kind of think of them in these buckets, then we can understand better on how to use them and better understand about their safety profile and why one drug might be better than the other drug. Okay? So today, the tease is we're going to be talking about aspirin. And as I stated earlier, and I have my prop here, I have my prop from my own cabinet. It's been in use for over 2,400 years, and it's probably one of the oldest medicinal agents. I can't off the top of my head think of one older than that, but maybe if I did some research, there may be some herbs and some alternative medicines that are used specifically in Chinese medicine and so forth. But certainly aspirin's been around for a very long time. And when we talk about aspirin, I want you to remember a chemical name, at least part of the chemical name, because it's going to help you remember not only why it works, but what side effect that you need to know about. So the generic chemical name is acetyl salicylic acid. And you may recall seeing salicylic acid because it's used as a topical keratolytic to break down the skin, and it does that quite well. But the oral formulation of aspirin is ASA, acetyl salicylic acid, and oftentimes in the hospitals they still will refer to aspirin as ASA, although those kind of acronyms are kind of being diminished in their usage by the use of computers to make it more clearer to the prescribers and to the pharmacists and nurses what the specific medication is. So we're trying to get away from using abbreviations, acronyms, as well as Latin acronyms, so that we're all on the same page as to how you're supposed to take this medicine. So ASA, acetyl salicylic acid. So here we go. This is my prop, right? If you opened up a bottle of aspirin, you may or may not know this, but I bet you don't. You can text me if you do. And if you smell it, you'll probably smell a small odor of vinegar. Okay? And that's because that acetyl grouping is acetic acid when it's in moisture, and that acetic acid is vinegar. So it's okay if your aspirin bottle has a small hint of vinegar, but if it's a very strong odor, it's almost likely that that medicine is too old to use. And when the drug is around, let's say, for example, in a medicine cabinet in a bathroom, where there's a lot of moisture, the moisture catalyzes that effect of degrading into vinegar, which diminishes the effect. So I recommend to a lot of family members and patients in the past to store your medicines under lock and key in a dry room storage area, and under lock and key high up to keep them away from children, but also to keep them in a dry storage area away from moisture. Okay, so that's a key little pearl about aspirin. And medications in general might not be best to keep in a bathroom. So something to think about when we talk about safety in your home. All right. So, briefly, okay, it was in the 1800s where pharmacists were reformulating salicylates, which were extracted out of willow bark, which is what they, 2,400 years ago, was getting the medicinal properties of reducing fever and pain, but they didn't really understand what was it about willow bark. And eventually it was coming down to the salicin in the willow bark was creating that medicinal effect of reducing fever and inflammation. And so pharmacists reformulated it, and eventually it was synthesized by a chemist in 1853 by the name of Dr. Gerhardt. And he synthesized with a very simple way of formulating acetyl salicylic acid in 1853. And then it was Bayer Pharmaceuticals that actually synthesized what we know today as aspirin acetyl salicylic acid. And you know how we talked about last year about every drug has a brand name? Then there's the generic name, which is a little bit more difficult to pronounce. And then there's the chemical name. Well, Bayer, when they redeveloped the formulation in 1897, they brand named it aspirin, all right? But they eventually lost that brand name patent, and so now everyone else uses aspirin. And aspirin then has a number of different brand names associated with it, depending on what the product is. So I just find that a little bit of a intrigue, a little factoid about aspirin. And as newer agents were being developed over 20, 30, 40 years, 50 years, like Tylenol and ibuprofen, aspirin usage declined, but in the past 10 to 15 years has had a resurgence because we've understood that acetyl group, that acetyl salicylic acid, when it's cleaved off from the core structure, is associated with a reduction in heart attacks and stroke. And so another indication now for the past 10 to 15 years have been using these drugs to minimize your risk of a heart attack or stroke if you're at risk. So that's an important thing to talk about with your doctor and your pharmacist. Not to take that just because to take it. We always have to understand what the clear benefit is to taking any medicine, including aspirin, and if you, specifically you, can benefit from that drug for that reason. Interesting, huh? I thought it was, ever since I learned this in pharmacy school, I thought it was very interesting from the first thing. So we now move on to aspirin is beneficial in many ways. It can reduce the risk of colorectal cancer. It can reduce, as we stated before, the risk of heart attacks and stroke. It can reduce pain, fever, and inflammation. But there are a number of people that should not take aspirin. And if they do, they should be monitored very carefully by their doctors and pharmacists for any kinds of side effects. And I always feel when I talk specifically about one drug, I really need to communicate these precautionary statements and patient populations to think about. And again, even though a drug is available over the counter, all drugs have side effects. If you misuse taking the drug, so we don't take these drugs for prevention. We take these drugs because we have a symptom, we have pain, or we have a fever, or we have some kind of inflammatory condition like knee pain or back pain. Okay, we do not take them for prevention. It's important to know that. Again, we do not recommend generally taking these medications for women who are pregnant, adult patients who have liver disease or chronic kidney disease. It's important to realize when you take aspirin on a long-term basis, it increases your risk of developing chronic kidney disease. And everybody needs at least one good kidney. So again, take the medicine only when you need to and for short duration of time, unless otherwise specified by a clinician or a pharmacist. They shouldn't be taken, aspirin now, should not be taken with patients with a clotting disorder and high blood pressure. So if you have high blood pressure and it's uncontrolled, aspirin can only make that worse. So you wouldn't take aspirin, we would use an alternative, like, for example, Tylenol. But again, it depends on your specifics that you would discuss that with your doctors and prescribers and clinicians and pharmacists. And surgery. So we talked a little bit about how it reduces the cardiovascular risk and stroke. It does that because that acetyl group, that vinegar, binds irreversibly to platelets, which alter platelet function. So if you're undergoing surgery, right, you need to talk about whether the doctor wants you to stop the aspirin 1 to 2 weeks before the surgery. Sometimes that's missed, believe it or not. Sometimes that's missed and it shouldn't be. Or they may give you that information on a detailed card, but again, it's information overload and some of these issues are complicated and difficult for people to understand. Okay, so we talked about aspirin. Did you ever notice why sometimes they come with a ball of cotton in them? And that's so in the distribution, the transit of the drug, the tablets don't break, right? We see that less and less often now because the dosage form and the formulations are so sophisticated now that that's not an issue. But back when they started first packaging aspirin, it was an issue that the tablets would crumble and crack, which makes it more difficult to administer. Okay. I'm just looking at my notes. I already talked about that. That's good. It's important also that if there's an accidental overdose of aspirin, for example, a child got into an aspirin bottle and started eating and swallowing it like it was candy, all right, it's important to immediately call a poison control center because there are antidotes that can be used as quickly as possible to avoid the toxic effects of overdosing on aspirin. And that number is, and again on the replay, I will have it in a text, but right now it's 800-222-1222. Again, that's 800-222-1222. And that's a good number to have stored in your cell phone or written down somewhere on a bulletin board or something like that, just in case there's a medical emergency associated with overdosing on any medication, and in particular aspirin. In extreme high doses, aspirin can cause hearing loss, seizures, coma, and there are other complications associated with it as well. So again, if someone had accidentally ingested way too much aspirin, be safe, be cautious, and call the Poison Control Center, which are usually free of charge. I'm not sure if this one is, but I'm pretty sure it probably is. It's provided by the state of California. The other thing I want to make note of, and this is a plug for our new PNN Plus mobile health app. If you download the PNN One app, either at Apple or your Android store, or update your existing one, you'll see all these beautiful new tools and tabs on the PNN mobile app. And there's a tab called, it's very easy to use, and if you don't use a smartphone, ask one of your children or grandchildren to show you how. You just hit the button Virtual Pharmacy, and information then becomes automatically streamed in from the FDA with very user-friendly language and easy-to-use search tools. And it's really great for finding about the right dosage, the side effects of the drug, the indications of the drug. And then there's an additional function, there's a pill identifier function. So if you find some pills and you don't know what they are, you can just go in there and type in the color, the shape, and the number on the capsule or tablet. And then there's a drug interaction tool. And I really highly like to have you all look at that drug interaction tool. You type in the names of the drugs that you're on, and it will search whether you have a mild, moderate, or severe interactions. And with aspirin, there are quite a few drug interactions. And this particular forum today, drug interactions beyond the scope, because I will never finish this in 15 minutes, and I probably won't finish this in 20 minutes. But so use the drug interaction and then bring that to your pharmacist or to your prescriber and talk about it. For example, aspirin has a moderate to significant interaction with drugs called SSRIs, selective serotonin reuptake inhibitors. Like a common one used is Paxil or Zoloft or so forth. And when those drugs are used in combination, increases the bleeding risks associated with it. So again, if there's an alternative drug to use, all right, other than aspirin, then it makes sense, even though you might not be experiencing any side effects, signs of bleeding, or bruising, or changes in your stool color, a black tarry stool or a bright red stool indicating excessive bleeding. It's better to do it preventatively rather than take the chance that you could have something, especially when there's alternative medicines to use that have less serious drug interactions. So after you get off of the phone, go into your PNN Plus Health Map, pull up the virtual pharmacy, check out the drug index, but also check out drug interactions. But don't freak out. I mean, sometimes too much information is freaking out. Don't freak out. There are pharmacists available 24 hours a day, and you can talk to a pharmacist. You can go to a Walgreens, CVS. They're open 24 hours a day in the United States. You can call your doctor Monday or Tuesday. Monday's a holiday, so I'm not sure how many are practicing, and discuss that over the phone. Or just not take the aspirin today and take something else that might not have that interaction, like Tylenol or ibuprofen, okay? So don't freak out. It's better to have the information, to think about it and react logically. All right, that's what this is all about. This is all about empowering you with information that I feel, as a clinical pharmacist and scientist, I feel is very important for people to know about, especially for my family and loved ones. Okay. So when in doubt, ask your pharmacist. They're the medication experts in the world. Okay. So I didn't make that notation about drug interactions. There are numerous, and if we talked about them all today, we'd never be done. So we're just going to give you a advisory and a warning associated with it. So again, at Pharmative, we always talk about the benefit versus the risk. and versus cost. This time, we don't really have to talk about the cost because aspirin is cheap. However, some of the newer formulations, which are more expensive, unless there's an absolute specific reason, don't necessarily think that you're getting something better just because it's in a prettier package and you like the color of the capsules or the gel capsules and so forth. Generic aspirin works just as well. And you want to take it with a full glass of water. And the reason for that is you do not want it getting caught into your food pipe. And you want to get it into the stomach, and you would like to take it with some food because that aspirin is irritating to your GI lining. So full glass of water, take it with food. You don't have to take it with food. I mean, there's some medicines that it's told you need to take it with food. However, the food will allow it to be less irritating to your stomach. So I still say, unless there's a specific reason, just buy the generic aspirin. It works just as well. And some of the other products and so forth don't really have that much of a therapeutic advantage. But it's up to you if you want to spend a little bit more money. So let's remember again the indications why we would be taking aspirin. Pain, inflammation, and fever, and all NSAIDs have that benefit. But the two benefits that is unique to aspirin is reducing cardiovascular events in the future. So if you have a prior history, discuss that with, again, your doctor and your pharmacist. And the other reason is more and more evidence is coming that aspirin reduces the incidence of certain types of cancer, specifically in this case, colorectal cancer. And depending upon the indication, the dosage is different. You've all heard about baby aspirin. Excuse me. I'm going to have to take some of my water here with the brand new Pharmative mug. We'll have a Pharmative mug contest one day. So depending upon the indication, the dosages change. So sometimes, it's 325 milligrams once every other day, or a baby aspirin, which is 80 milligrams every day. That's usually the dosage for reducing your risk of cardiovascular events. The colorectal dosage to prevent colorectal cancer is 75 to 100 milligrams. And generally speaking, the pain and inflammation and fever dosage is 2 tablets of 325 milligrams, which is 650 milligrams. So it's important, again, to know why you're taking it and what the appropriate dosage would be. Obviously, the more you take it, the more side effects you're going to have. The longer you take it, the more side effects you're going to have. So you don't want to take more than you need. So that's why I bring that to your attention right now. And then I want you also to be aware of some of the more severe adverse reactions associated with it. Allergic reactions, which can be an anaphylactic reaction or referred to as a hypersensitivity reaction. This is one medicine that is commonly flagged in your medical chart, and it should be in your healthcare diary or journal, that you have a severe reaction to aspirin, because we don't want you to be receiving aspirin and have that reaction again. So, ringing in the ears, especially at higher doses, aspirin causes ringing in the ears. So if you have hearing problems, again, discuss with your clinician, prescriber, whether or not aspirin's right for you. It can cause seizures in high dose, and it can cause excessive bleeding. That's why it's used as an antiplatelet effect. That acetyl group, ASA, that acetyl group is what is the benefit to all of these indications. That acetyl group binds to platelets, so there's less clumping of the platelets. That acetyl group binds to an enzyme called cyclooxygenase, which is irreversible, and that's what decreases prostaglandins and thromboxanes. I think I mispronounced that, so I'll have to correct that in the re-edit. And that's what reduces inflammation, okay, and fever. And so understanding that of ASA, you'll remember that acetyl group causes vinegar odor. It attaches to platelets. It attaches to the enzyme associated with reducing prostaglandins, so therefore you're getting a therapeutic benefit there. And also that acetyl group helps prevent certain types of cancer like colorectal cancer. So all you have to do is remember ASA, and you're going to come across looking like a genius. And you're going to understand why aspirin is different than all the other NSAIDs, which we're going to talk about next week. And I already mentioned to all of you, common side effects now. Upset stomach, that's why we take it with a full glass of water and food. Heartburn, again, full glass of water and food. It may even cause some drowsiness. That's not so much of a concern, but again, you should be aware of it. Every medication may affect everybody a little bit differently. And finally, it can even cause a mild headache. So again, everybody is a little bit different. Some people love products like Excedrin, which contain aspirin and Tylenol and caffeine, which I've used for a migraine, and it works actually pretty well. The caffeine has an additive synergistic effect with the aspirin to relieve the pain of severe headaches and migraines and so forth. Some people like ibuprofen better, and it's what really individually works best for you. Okay? All right. I think, again, I'm just going to leave you with one last thought. Always weigh the benefit versus the risk versus the cost. You only take medications when there's an absolute need and an absolute determined benefit. All medications have side effects. The higher the dosage, the longer you use it. Drugs like aspirin can cause kidney disease, liver disease, hypertension. So again, you only want to use it when absolutely necessary for a symptom, and you want to use it for the shortest period of time, and you want to follow the prescribing instructions on the package insert, which you can also get through the virtual pharmacy on our PNN Plus Health app. Works like this, streams like this. I'm addicted to PNN Plus Health app. It does anything and everything you want to do, except it doesn't have your credit card numbers, because we don't take credit card numbers. We provide this as a service to you, and PNN Media and our PNN studios make money through advertisement dollars and assisting clients with, production of promo videos and podcasts and so forth. And then you'll hear a limited number of commercials on our networks like PNN.FM, great dance music, PNN.1, where we have old TV shows, retro cartoons, old movies. And again, you'll see all of that from our... Whoa, I just dropped one of the phones. You'll see all of those with limited commercial interruptions at no cost to you, and that's my promise to you. We don't charge the customers, the people that receive this information. It's basically a passion of mine to provide this information with regards to medicines and healthcare in a way that will help you and your family improve your healthcare. So that's it for Pharmative Live today. I thank you for joining us today. You can always send your questions to info@pharmative.com. And I always sign off by saying, stay healthy. That's the best thing you can do, is stay healthy. Nobody wants to be sick, and it's easier to prevent disease than it is to treat disease. So with that, I sign off, and I'll see you next week at the same time. Thank you for being part of Pharmative Live, and send your questions in, info@pharmative.com. Next week, we're going to talk about Tylenol. So I look forward to that too. Bye.